Like, we focus on what are the simple things to measure patient success. Do you get back to work? Do you get back to sport? Are you pain-free? Et cetera, et cetera. But you know what I haven't ever seen is somebody to double down and have a really good proms for an amputee. Because we feel like we failed. And it's almost like, all right, so that patient is no longer being admitted to the hospital. They're no longer on antibiotics and they're out of pain. But man, they're missing a limb. We're not going to focus on them. But what happens if we did? I bet you would find some of the happiest patients if we started asking some of our most difficult population what they define as success. It's probably also starting with the beginning question to them is asking the patient, what outcome are you looking for that you would define as success? Getting up front, looking at that ahead of time. You know, in the hard conversations, like, for instance, the third conversation we haven't really talked about is when I have to tell somebody no and say, I think that hospice and really focusing on quality of life is the better of the two options here. And I don't offer that right away, but when I listen to a patient and they say, I just want to be home with my family, I just want some more good days, that is a no-brainer of saying, I can meet you where you're at, get you out of the hospital. I have a wonderful team. Remember that whole concept of empowerment that I'm going to get you plugged in with. And we're going to make sure that you are at home with everybody that is important to you for the rest of your life. That's a powerful conversation to have. And ultimately, again, Ahmed, it all boils down to the simple concept of the patient's definition of success is really the only one that ultimately matters.